Aloha, welcome. Thank you for joining us today. My name is Dr. Violet Horvath, and I'm the Director of Pacific Basin Rehabilitation Research and Training Center. Today we're going to be talking about one of our projects, the Hawaii Neurotrauma Registry, and we're going to have a specific focus today on traumatic brain injury. Let me introduce our special guests first. So we have Mr. Colin Whitehead, who is our project specialist for the deaf and hard of hearing at Pacific Basin Rehabilitation Research and Training Center. And we also have Dr. Robert Sloan, who is a physiatrist with Concussion Care Centers of Hawaii and president of the Hawaii Medical Association. I'd also like to introduce Ms. Patty Sakal, who is doing American Sign Language interpreting for us. You'll see her in the screen there throughout. And someone you can't see who's off screen, Mr. Dewayne Berg, who will also be providing American Sign Language interpreting. So let me take a moment to tell you about the Hawaii Neurotrauma Registry. Pacific Basin has a contract with the Department of Health to administer this registry, which is voluntary for individuals who've had stroke, spinal cord injury, or traumatic brain injury. It's a unique project, and it's very important because, as far as we know, this is the first time we're looking at information from individuals once they have left the hospital or been discharged from the rehabilitation facility. Who is eligible? Any Hawaii resident who's had a stroke or a spinal cord injury or a traumatic brain injury of any age at any time. Okay? We also provide educational services to the public, and for any Hawaii resident who's had one of these neurotrauma injuries, we provide a personalized information and referral service. So the person who's had the injury can contact us, or it could be a family member or another caretaker, whether they choose to be in the registry or not. Now I'm going to suggest that you get a pen or a pencil and some paper handy, because at the end of the program we're going to show you some contact information. You'll be able to go to a website and fill out the survey yourself if you like. You can give us a call and we'll work on the survey with you. Or, as I said, you can also call us to get that personalized information and referral service. As I mentioned at the top, today's program is going to be on traumatic brain injury. So let me dive right in with our special guests here. Dr. Sloan, you are a physiatrist. Now, I'm going to guess that most of us have no idea what that means. So can you tell us in a couple of sentences, what does a physiatrist do?
Yeah, thanks for asking that question, because a lot of doctors, even here in Hawaii, don't know what that is. It comes from the Latin root physis, which means nature, so we're considered to be a little bit more natural and more holistic in that sense. Best way to look at it is it's like being a neurologist and an orthopedist put together from a holistic standpoint. We kind of emphasize performance enhancement. We try to maximize function, and essentially whether it's an athlete or anyone who's been injured, we try to essentially make them the best they can be with what they have. So we're trying to essentially maximize their performance.
So we hear a lot of terms, and help us out with this. So today's program is on traumatic brain injury. So what is traumatic brain injury, and what is a concussion? Is that the same thing, or are they different?
Great. Well, traumatic brain injury is the umbrella, and we used to call it head injury, but it's best to kind of define it for what it is. It's a brain injury, and it's a mechanical impact injury to the brain, but the head doesn't have to be hit. The body could be hit hard. In the case of veterans, a blast injury just from a blast wave can cause a traumatic brain injury. And what happens is the brain inside the skull gets bounced around, hits bony prominences, can get bruised, it can get twisted in what we call shear stress. I like to call it the brain gets shaken and stirred. And again, the important thing is anything that causes a mechanical impact on the body or head that causes the brain to get damaged inside the skull. A concussion is a type of traumatic brain injury, a less severe, what we used to call a temporary injury to the brain, but we now know that concussions do actually have some permanent sequelae. And but the important point is that it's not as severe as the kind of brain injury that causes contusions, bleeding, and fulminant swelling that can't be controlled. So in that sense, it's a less severe traumatic brain injury. And importantly, there doesn't have to be loss of consciousness. In the past, everybody thought that you had to actually lose consciousness, and we know that's not true anymore.
You know, at the time we're taping this, it's just before the Super Bowl, and so our viewers may have be hearing about something called CTE. What is that?
Chronic traumatic encephalopathy. That's really, that's the big thing the last few years that got me back more involved and started the Concussion Care Centers of Hawaii here. Chronic traumatic encephalopathy is a progressive neurodegenerative brain injury disease that is due to repetitive trauma, so repeat damage from repeat concussions. In the case of our veterans, a blast injury, this is kind of interesting, a blast injury can cause an impact concussion, then the veteran can fall and hit his head again and get another concussion, and then superimposed on that is the blast injury, where the wave from the blast in the war, for instance, actually moves through the brain and causes additional damage on top of that. And that's become very important because traumatic brain injury is actually the key injury in the recent wars in Iraq and Afghanistan. So repeat injuries to the brain of any kind leads to this chronic traumatic encephalopathy, which is characterized by memory loss, behavioral problems, and depression. And what's happened in the NFL is we've started to realize that a lot of the impact injuries that occur in football and other sports, whether it's boxing or steeplechase in the Olympics for that matter, leads to chronic problems that seem to get worse later in life. And that's really the key. There's two kinds of chronic traumatic encephalopathy. The one from repeat concussions, and you're actually suffering ongoing problems from that. And then there's this one that we're worried about now where you have late deterioration, 10 to 15 years after your injuries have stopped. So you've stopped getting concussions, you actually may seem okay for 10 to 15 years, and then you suddenly deteriorate. There's two kinds. In the earlier, younger ages, you get more behavioral problems, and sometimes behavior problems, it's hard to just blame that on brain injury, but we need to be more aware of that. And then the other type is the type where you get more memory problems and dementia later in life. The real full-blown chronic traumatic encephalopathy has all that: memory loss or dementia, depression, and behavioral problems that have actually led to suicides in people that were NFL players and in other, even younger people who have played football and boxing, for instance, have been shown to have this from multiple concussions. And I guess one other point to make is, well, a couple of points. One is you can't diagnose this easily until after death because it requires a brain biopsy. And what you're looking for in the brain biopsy are these abnormal proteins called tau. And tau is a misfolded, misprocessed natural protein in the brain that, due to these impact injuries, gets damaged, misprocessed, hyperphosphorylated, and deposited around blood vessels and nerves and causes blood flow problems and nerve death. And so what we think happens now 10, 15 years later is very interesting because it's similar to mad cow disease. This is the newest thing. In fact, the guy who discovered mad cow disease is now being invited to every brain injury talk in the world because of it. And it's called the prion spread theory. We believe that these tau proteins, these abnormal deposits that cause the chronic brain damage, later in life start to spread. And they actually spread into areas that weren't previously damaged. And that seems to cause this deterioration 10 to 15 years later that can lead to emotional problems, depression, and behavioral problems that lead to suicide, that lead to violence and other things like that. And the point about the prion, the mad cow disease prion, also seems to actually show up some years later after the infection. So it's very interesting. They're not the same problem, they're not the same protein, but the process that's involved is similar, and we're hoping that by studying both, we might be able to help both of these problems in the future.
Well, it's clear that there's a lot we don't know yet. Well, thank you for that, Dr. Sloan, and we'll come back to you in just a moment. But I'd like to talk to Colin for a moment here. Colin, you've sustained 6 documented concussions, and some that you think were not even diagnosed, that you might have had prior to that. Tell us what happened.
Well, also, as you mentioned, when I was younger, I hit my head several times. Maybe I was playing pee-wee football or just horse playing around. So I've had several undocumented concussions. But my first documented concussion happens when I was 16. I was a sophomore in high school, and I was playing football. I was on the punt team, and we had punted, and I was away from the play. I was completely blindsided, and I was knocked out. And the trainer came over and said, "Oh, your football season's going to be over," and that was fine. And then a week later, it was our school homecoming. And I didn't play, but I was just walking around on the field just before the game started. And we had just had a freak accident. The kicker kicked the football, and the football hit me right in the head, and I was knocked out again. So both of those incidences happened within a week of each other.
Wow.
And so my symptoms from the first incident weren't resolved yet. And so I had 2 severe concussions. And so my football career was over before I knew it. And that was fine with me because I only played football for enjoyment, but basketball is a different story. Basketball is my first love. And I wouldn't quit basketball for anything. But I know that having 2 severe concussions that happened within the week, I knew that it was possible to get another one again easily. Easily playing basketball if I got knocked in the head or if I fell on the floor and bumped my head. So it's easy to happen. Once you have 2 or 3, then you will have 4 or 5. Mm-hmm. It's easy to get that. And so horse playing, when I went to Gallaudet University, my goal was to play basketball there. And I got on the team, and then 2 days before our first game, I had my 6th concussion. And that's where the doctor said, you have to stop. And I remember looking back, I mean, is this really happening to me? Did this happen to me? It's scary. It's really scary.
Now, I know that concussions can have an effect on hearing. Were your concussions related to your hearing loss?
Oh, that's a very good question. I get asked that quite frequently. But no, I was born deaf. And you're right, concussions can sometimes cause hearing loss, but for me that was not the case.
Now you've had some time to look back, and looking back, is there anything that you would have done differently? Do you have any advice for others?
Well, you know, you're talking about 16, 17-year-old boys. They're competitive in sports. And I wasn't thinking of the big picture. You know, I was just thinking of the now. And so, for example, I was having concussion symptoms, and the trainer would ask, "Are you all right?" And I'd say, "No, I'm fine. Everything's fine." So looking back, I saw that I was very reckless in doing that and taking the situation lightly. But there's bigger things in life than just playing sports. So looking back, yeah, I think I would have done things differently.
Mm-hmm. And you're only 25 years old. What do you think about the future? What makes you worry about the future?
Like Dr. Sloan mentioned about the NFL, you know, the players going through depression, suicide, the long-term effects from concussions. And I'm only 25. And does that mean I have to sit? My sister and I, we were sitting watching ESPN. And you see it on the news, and you hear about it more often, that players are killing themselves, or the NFL is scrutinizing a certain issue. And so, I mean, felt so surreal. My sister was like looking at me and like, this is my brother. Will this happen to my brother in the future? I'm only 25. You know, I want to have a family. I want to have children. But do I want them to deal with what I have to go through if I go through with the effects of having a concussion, depression, and such? So it's really scary.
Mm-hmm. You have made a choice to join the registry as a TBI survivor. Why is that important to you? Why did you join?
You know Jamie Valvano? He gave a great lecture, speech on the research, and he said it's not about me. It's about people that I love. And so I'm joining that registry because I'm giving them information, and hopefully that they'll be able to increase and improve something. And so maybe it will help my sister or somebody that I love. And that's what's important. It's not about me. It's about preventing people, other young people, to having to go through what I went through.
Yeah. Thank you, Colin. Thank you for telling your story. Now, Dr. Sloan, Colin's injuries, and for the most part, he was hit by something or someone, but there are a lot of causes of traumatic brain injury. What are the most common ones?
Good question. You know, in Hawaii and nationally, falls are actually a really common cause, and doesn't matter if you're falling from your ladder or falling down the stairs or falling from a mango tree here in Hawaii. Brain injury from falls is very common, can be one of the worst sequelae of a fall. As we mentioned, sports is actually probably more common of a cause than we thought. It's actually not high up on the list of causes in a lot of studies, but that's because we're missing what I call the silent epidemic, these mild concussions that are being missed, whether it's on the field or in the emergency room. And these even when you've had a concussion with symptoms, it's often missed. I know that because I see the patient often after the acute care, and then I find out, well, you had a concussion, we need to address that. But there are these things called subconcussive blows that are very important. And those are, really it's a misnomer, it's a concussion, but it's a concussion without symptoms. So we call it a subconcussive blow. And in some studies, those are even more important than the concussions where you lose consciousness and that kind of thing. Other causes include motor vehicle accidents, assaults. As I mentioned, if you have impulsivity problems, and I love the way you described that. This is actually a great talk. This might be one of the best I've ever been involved in because you're here. So I really want to thank you for that. You said you felt like you were a little reckless. And the problem is concussions can make you more reckless. As young adolescents, I know I was reckless. And if you have impulsivity problems and you put on top of that depression, behavioral problems of other kinds, it makes you more likely to get another brain injury. So we really have to watch out for this in our keiki and our youngsters. And then just being struck accidentally. I've had patients even recently, 2 of them had the parking gates land on their head, garage doors falling on your head, your own car lift. Mine right now is damaged and it tends to fall. I've got to get it in and get it fixed because it can fall down, hit you in the head, more likely to hit the young kids next to you because they're lower, to hit them harder. So it really is dangerous. And if I didn't mention it, assault is a common cause also.
So how could someone tell if they've had a traumatic brain injury? You've mentioned a variety of things, but what would be some of the symptoms that would give a person a sign that they'd had one?
Well, one of the most subtle ones is really important because you might not have the other symptoms, but just not feeling yourself, not feeling well, can often be a sign of a concussion. Of course, if you've had an impact to your body or your brain. For instance, in a motor vehicle accident, you might get a whiplash, and you might not realize that a lot of your symptoms are from the concussion. So just not feeling well, having a headache, dizziness, fatigue, confusion, memory problems, as I mentioned. And interesting, we were talking about hearing problems, but one of the most common, what we call cranial nerve injuries in concussion, traumatic brain injury, is the loss of smell, because the smell nerves come right through what's called the cribriform plate, which is a bony plate where there's these little holes for the nerves to come through, and it's real easy to slice and injure those nerves, and it can affect your taste as well as your smell because of that. So we actually look for that as a subtle sign of brain injury.
Wow. And so if someone thinks they've sustained a concussion, what should they do?
Well, first of all, I recommend seeing an expert. And one thing to remember is you can't ice the brain. And most injuries, whether it's sports or other accidents, ice is my primary treatment. You ice an injury, at least for a day or two. If you do it properly, it calms down the inflammation, helps to heal. We can't ice the brain. That's the real problem. So the number one treatment right now is rest. And sometimes that means more than just physical rest. That even means cognitive or brain rest, meaning that in kids, for instance, we don't want to overload them with schoolwork. We don't want them playing a lot of video games. There is a concern now that I've spoken at recently in town, though, about resting too much. And I've actually been talking about that for years because, like happened with you, when you're told, Colin, that you can't play sports again, that can be devastating to a young man or a young woman. And that can lead to depression and other problems that actually becomes worse than the concussion. So rest is important, but you don't want to over-treat. You don't want to over-rest them. You actually want to, like with any injury, you want to actually rehabilitate them early, stepwise as you can. And we actually have a good program here in the state at the high schools where there's a 6-day rehab program. Once I release them back to play, they have a 6-day rehab program that is a graded day-by-day progression of activity. But rest is very important, and protecting your head from another injury. How do you do that? Well, sports synergy. I had a case recently, a football player in town actually had 2 concussions during a game and wasn't pulled out right away. And then he was symptomatic, but he was allowed to go out and surf the next day at Sandy's, even with that ongoing headache, which is a no-no. So if you have symptoms, you definitely need to rest and not participate in any activities, especially sports, that could lead to another concussion. He hit the sand so hard he had even a worse concussion. As Colin said, each concussion makes it more likely to get another one. That's why in boxing, the first concussion sometimes is the beginning of a downward spiral for these athletes, same as in football and other sports. So rest is very important, protecting the head. I wouldn't recommend that you go out and do a lot of driving. Even if you're a youngster and somebody's driving you, you want to protect them, be more careful driving, because car accidents are a very common cause of brain injury. Helmets are important. I wouldn't recommend you go out and ride your bike immediately after a brain injury, because you're more likely to actually fall and have an accident because of the sequelae. It's even been shown that orthopedic injuries like knee injuries are more common after a concussion. So guess what? You get a knee injury or you stumble and fall, get another concussion on top of that, and it's just everything is involved when the brain runs everything. So helmets are very important if you're going to go out and ride a bike or a motorcycle. And some patients need to wear a helmet just to walk around during the day because they might have a seizure and fall and hit their head again. So there's a lot of different things we can do, but preventing re-injury, preventing activities that could lead to another concussion when you're not fully recovered from the first is very important. We do have tests now because, as you know, athletes will deny that they had a concussion because they want to play. And we do have tests called neuropsychological testing that we can perform. And at the high school right now, the kids in all the DOE high schools in the state and most of the private schools, they're required to do pre and post neuropsych testing called impact testing. And we're actually able to get baselines and then check them after their concussion to see if they're back to normal, just in case they don't want to be completely forthcoming about their symptoms and play before they're ready.
Dr. Sloan, why is it important for people to join the Hawaii Neurotrauma Registry? How could having that information help?
Well, you know, we are tasked with finding the incidence and prevalence and the needs of our neurotrauma survivors. So I've been talking mostly about concussions and brain injury, but it includes stroke and spinal cord injury. And a registry like ours can provide medical providers, can provide legislators, can provide researchers with more information so that we can provide better care and change legislation, for instance, and guide research for our neurotrauma survivors, and hopefully also prevent future injuries.
Well, thank you very much to both of you. You've given us some wonderful information today. Colin, your story is so compelling, and I wonder how many other people out there heard your story and thought, wow, that sounds like me too. And Dr. Sloan, all the wonderful information that you've given us today in terms of the common causes and what to do if someone thinks they've had a concussion. So thank you to both of you. You know, Colin was blindsided when he got his first traumatic brain injury, and he never saw the hit that was coming that gave him that first diagnosed concussion. And he didn't ever expect he was going to get a concussion. None of us really would think about that. And I would guess that most, if not all, of traumatic brain injury survivors would probably say the same thing too, that they were blindsided by this. They didn't expect to be hit by something or someone, and they never expected that in just a few seconds' time, their lives were going to change forever. You can never get that back. So for those of you who have had a traumatic brain injury or stroke or spinal cord injury, please consider joining the Hawaii Neurotrauma Registry. We really need your information. Remember, the only criteria is that you're a resident of Hawaii. Thank you very much.